Gupta, chairman of Easton's group of hotels, about the response of the Gupta Family Foundation to the COVID-19 crisis in India. In the wake of the devastation in India caused by the spiraling COVID-19 cases, the medical system in India has been overwhelmed. The country has a record of almost 300,000 deaths. Beds, oxygen machines, and medical workers are in short supply. Some patients are dying in waiting rooms, and cremation grounds are piling up faster than workers can handle. At this critical time, Dr. Steve Gupta and the Gupta Family Foundation, with contributions from other entities, has donated 300 oxygen concentrators, which have arrived to India. An additional 100 is being delivered.
Hello and welcome. I am Patricia Mawa. Now, India is experiencing the world's worst outbreak of the COVID-19 pandemic, with new cases surging past 400,000 per day. There have been about 4,000 deaths every single day, and more than 25 million have been infected by the disease. My heart goes out to the people in India. Today, I'm being joined by a man that is at the forefront of sending help to India from Canada. He's a Toronto developer, hotel chain owner, and philanthropist. He's a chairman of Eastern Groups of Hotel and founder and chairman of the Gupta Family Foundation. I'm talking about Dr. Steve Gupta. Hi, Dr. Gupta. How are you doing?
Hi, Patricia. Good to see you. And thank you very much for doing this for us. And thank you for giving me the opportunity to talk to people, to create some awareness about what's happening in India, and hopefully to inspire some people to help. Because any country that's in that kind of trouble, we all should get together and try to help.
Yes, I totally agree, because we're all one global family. Now, Dr. Gupta, rather than just watch the news and see the devastation in India, you decided to pull resources together and mobilize the community to support. And as we speak, a plane full of, ventilators and other materials have been sent to India to help out with the COVID-19 situation. Why did you decide to do this?
As everybody else here in Canada and rest of the world, we are watching the news, and it's been terrifying. We are heartbroken to see all the people suffering and what's going on. And it hit like a tsunami wave over there. It was very tough. No country could survive India, let alone India, with that much population. So we felt that we should do something. My daughter, Ritu Gupta, who is the president and CEO of our Eastern's Group and Gupta Group, I'm the chairman, founder and chairman. She sent an email and on May 1st to all mass emails to all our friends and associates that we do business with. It's around 3 p.m. And within 10 minutes, we had pouring support, and we had $75,000 already committed at that point. Wow. And over the weekend, we started working, trying to find out how do we send help. Sending money is easy. Anybody can write a check and send it over there. Where the money goes through Red Cross, what happens? Obviously, it happens and whatever good things happen, but really we don't have any control. We wanted to help people directly. So we investigated and did a lot of research over the weekend. On Monday morning, with God's grace, we were directed into the right path. And I can also tell you, I'm very much believe in God, and I prayed, God, if you want me to help these people, help me. So within hours, I found the source. I found the oxygen concentrators in Nevada and in New York. I found these people. Everyone is trying to make money. They, whatever you call them, take advantage of the situation, so they increase the price, but I was able to lock the price, get it done on Monday, and they were delivered by Wednesday. Then it was hard to find even air freight to get any airlines or cargo planes to go there, because these days, I don't know if you know, in the world, cargo prices have gone 3 to 4 times. And that's how much demand there is. I don't know why, but and I didn't know that. We have a partner with Emirates Airlines, and they stay at one of our hotels. So I contact them, ask them on a humanitarian basis, try to help us, and they were very, very graceful to help us, and we paid for it, which is fine, no problem. But by Friday, we had 300 oxygen concentrators on the plane. We had to also secure some power converters because India is on 220 volts and Canada is on 110. So I was fortunate through our resources in Montreal, through one of our managers, Mario Colucci, and he was able to go somewhere, and they scrambled in 5-6 warehouses and were able to find 300 of them. And we sent the whole thing together, and it landed in India on Sunday, which was 9th of May. We shipped on 7th of May, and I have a very close friend who is very influential in Delhi, and he had to call the aviation minister to clear our shipment from customs within 4 hours. And Monday evening, it reached the location where we wanted to. By Tuesday morning, it was already deployed to 150 patients there, and the other 150 were sent to Punjab, where I was born, and they were sent with police escort. It's heartbreaking to see what's happening, but it's also heartwarming when people say thank you.
Wow. I mean, just the way you've described the logistics of, sending the help, it just sounds very complicated and quite daunting. But you did mention to the Toronto Sun in an interview that you're not done yet. And I know some people out there are wondering how they can actually support this as well.
Yes, we have secured another 250 oxygen concentrators. Wow. And hopefully tomorrow morning somehow I will be able to finalize that. And we also heard from India now, all of a sudden, the government has been working obviously simultaneously when the rest of the world is helping them and sending all the supplies that they require. They have enough oxygen now. They say they are short of cylinders in some remote areas. So we are trying to secure some oxygen cylinders, and one cylinder, about 40 or 45 liters, could help 6 patients. And we are thinking of trying to get 500 to 800 cylinders if we can. If that works, so within the oxygen concentrators or the oxygen cylinders, one of these things will be shipping this week.
This pandemic has exposed the disparity in the world between the developing countries and the developed countries. Some of the countries that are hardest hit, countries that have not been able to provide some of the necessary equipment for their citizens. For instance, the situation in India, and we saw that in South Africa as well at some point during this pandemic. Now, what do you think the Western world can do to make life better for people in other parts of the world? Because you see, something affecting people in China, in Africa, in India ends up, coming right here to Canada and the US and other countries. So what do you think they should do to make sure that the disparity, the gap is kind of narrowed?
Very, very good question. I agree with you 100%. It is important that not only for humanitarian grounds that we help people in India. We do whatever we can. I or my foundation or my family cannot obviously help all the billion people or 7 billion people in the world. But if we can do our little bit and everybody else does the same, that will help. It started from Wuhan in China, and the rest of the world has been suffering with this. And unfortunately, a lot of the Western countries have most of the resources. And sometimes I wonder what God is doing and made these countries so rich and the rest of the world not there or being in that poverty situation. But I think the West should open up because now is a global economy. The world is a global village. Travel has increased dramatically over the years. It's very important that Western countries help everybody. Because if they don't help these, whether it's India or it's Africa or any other countries, which are third world countries, the problems of those countries will eventually get here, and which won't be good for them. But right now, politicians don't realize that. They put embargoes on not sending something. I can understand they should protect your family first and your citizens first and then go there, but go there right away as soon as you can. And I think that is the message I would say all of us should give, that we must help and extend a helping hand to the people to get them out of this. And this pandemic, it happened after 100 years. And this kind of thing is important, that the whole world gets together. It's not one person's problem, and one person's problem could become the whole world's problem.
I agree with you 100%. Now, leadership, plays a key role in the rise and fall of anything, be it business or any endeavor. And you see that most of the countries where the leaders are complacent regarding COVID, the numbers are greater, like we saw in the United States when, Donald Trump was president. Now, we have seen in the news that, the leadership in India holding, some sort of political events that attract a lot of people. What have you to say to leaders, especially in countries where there's complacency?
I'm not taking sides with anyone, but my view is in India basically controlled the COVID situation very well in early this year. And from there, everybody became relaxed and too easy. It's not just the government, it's the public also. And there were 2 or 3 things happened. They have a big religious event that happened in April where 40, 50 million people got together in a number of days. It's a religious, once in 12 years it happens. It's a Kumbh Mela, they call it. And that should have been controlled. And then people were having parties, not wearing the masks and whatnot, because they felt that everything is under control, there's no problem. And same way the government started having their rally, there was election, they could have postponed, but they didn't know that this wave was coming. When this wave hit, it's very easy for anyone to criticize the government. And every government, whether it's right or left, all are criticized when in situations like this, because there's no right at the time. But everybody makes the right decision. But also, unfortunately, in India, people over there who have money, they got a little selfish. They were protective of their families and hoarding some of the oxygen and whatnot, which I'm hearing from the news. I have no direct knowledge from that. So it's a combination of a lot of factors that happened over there. Now somebody investigates to find out if government was to be blamed, then it has to be the government's fault. But normally I would say that is number of people's fault. It's people, government, and everybody took it easy. They felt we are under control and we are good.
You talked a little bit about Israel and a vaccine, and the vaccine is one way that we can, see hope. And COVAX has promised to send a certain amount of vaccines to developing countries. There's quite a gap between when, these vaccines are promised to developing countries and when they're received. Do you think there's some sort of hypocrisy regarding sending help to these countries?
Absolutely. Every country should do that. I think, fortunately, the vaccine companies were able to come out, like Pfizer, Johnson & Johnson, Moderna. They came out with a vaccine pretty fast as compared to this could have been 2 years. Who knows, then the whole world would be in real difficult position. But now and then their factories, they could not produce enough. Their factory had to be updated or upgraded. They were not ready for making billions of vials of vaccine. So that was part of the logistics, how the vaccine is made, where it's made, and sending it over. And then everybody, like I said before, got a little bit self-protective, if not selfish, try to help their own people first, and then try to send it out. So India initially last year, they sent a lot of the vaccine to other countries, to Africa and a lot of the Middle East and some other countries. And at that time, they had surplus because they produced 20 million vaccines a month, I believe. And but then what happens is their raw material comes from USA, and USA put an embargo on that they don't want to send any raw material for AstraZeneca. So India could not produce. So there was a gap in between that time. Otherwise, they would have a lot more vaccine over there. Because India produces 60% of the world's prescription medicines. Yeah. And I hear now India requested America to stop the patent on Pfizer and Moderna for a short time so they could produce also, or give them the formula basically. So that could help because they have the factories, all they need is a formula,
Yes.
and then they can produce. So I think in overall it'd be better that we all chip in, give a helping hand to the rest of the world, bring them out of this. And then the whole world is going back again. Then economy gets better, everybody gets better, and everybody starts making money
Right,
and
right.
pay their bills.
The Gupta Family Foundation has been around for some time and has done some amazing work. And I know there's work being done in Africa to alleviate poverty. Tell us a little bit about, some of the other things that the foundation is doing to make life easier for the less privileged around the
Well,
world.
we registered our foundation in 1986, and since then we have been trying to help whatever we can. And our main focus is education and health of people, and those are the two main objectives that we have. And so in India, over the years, I have been through my contacts over there, arranging some cataract operations. Over 11,000 people, those people who cannot afford or they cannot leave the rural areas and go to hospitals for various reasons, whether it's financial or otherwise, cannot travel. So we sent doctors to those remote areas and provided them food for 3 days, glasses, medicines, and full cataract operations. And we were able to get 11,000 patients, corrected their vision and cataract operations. And also we did in Rajasthan, this is another state of India. We were able to, through Lions Club, we were able to, of Toronto and Lions Club, World Lions Club, we were able to install a full sanitary system in a 500 girls school. So they would have proper washroom facilities and whatnot, which they didn't have before. So whatever projects come in front of us where we can help people, we can, and we try to do that. Our daughter, Ritu Gupta, who you know very well, president and CEO of our foundation, as well as our hotels and Gupta Group. She and my son Suraj Gupta, who is also our chief investment officer and foundation's vice president, they have both taken an initiative to build digital schools in Africa, and they've already helped send funding to Africa, and 4 schools have already been started the process. And they're also sending some tablets to have Wi-Fi set up in the schools, and so have an education system to improve their system so children could have better access to knowledge.
It's really awesome to hear about the great work that the foundation is doing. So Gupta, you're a very successful businessman. You're a developer, hotel chain owner. You own over 20, right?
Yes.
Now, this pandemic has hit, has affected all business people. What advice would you give to people out there? Because everybody's going through a lot right now. What advice would you give people out there who are going through so much, be it, deteriorating health or lost businesses or unemployment? What would you say to them?
It's unfortunate that we have our hotels are hurt very badly too for the last 13 months, and absolutely negative cash flows. We have been feeding them like anybody else. Travel industry is the same way. Restaurants are the same way. My advice to them: hang in there. I think we are at the end of the tunnel, and I think I don't know the time frame. Only God knows. But I say the next 2-3 months, by September, hopefully, if we get everybody in Canada vaccinated, I think once we open up, I think floodgates will open. People are fed up sitting at home, from what I hear. People are fed up having Zoom meetings. They have no in-between time to make a call or go somewhere. And I personally feel the business will get better. And I've also heard that people who have their jobs, whether it's public servants or good jobs that they have, and because they're not traveling, they have saved a lot of money.
Yeah.
Canadians have saved over $80 billion extra this year, and they will spend that money. So I say, keep your fingers crossed and think positive, and good times will come.
Amen. I say amen to that. And
Thank you.
finally, people who would like to support the relief efforts for India regarding COVID-19, how can they do that through the Gupta Family Foundation?
You have the Gupta Family Foundation link that they can online link. They can contribute there, or they can wire the funds. We can provide that information to your channels.
Well, thank you so much, Dr. Gupta, for being here. I really appreciate what you're doing. You've been doing so much philanthropic work over the years, and I think it's just sort of natural for you to do this at this time. And I thank you for stepping up to help the people in India.
Thank you very much, Mandy. What Patricia, you and your team and Moses is doing to help people and create awareness and inspire other people to do good things too. Doesn't matter what country we come from. We are all here in Canada. We are all human beings. We are all one. Doesn't matter what color of skin we have, but we are all human beings. Our blood color is the same. It doesn't matter who we are.
Yeah, just perfectly put. Perfectly put. Thank you so much again. Now, if you would like to support the work of the Gupta Family Foundation, especially in reaching out to the people in India, please visit the website appearing on your screen right now and do so. Let's all participate. As we said in this conversation, we're all family. So just make sure that you're part of this and you contribute and support the people in India. My heart and prayers are with them. My guest has been Toronto developer, hotel chain owner, and philanthropist, who is also the chairman of Easton's Group of Hotels and founder and chairman of the Gupta Family Foundation, Dr. Steve Gupta. Until next time, I'm Patricia Baby Amawa. Do take care and stay safe. Bye-bye.
To contribute to the humanitarian effort, donate to the Gupta Family Foundation account on Canada Help's website.